Today we're going to take a look at licensed professional counseling and our professional identity. Licensed professional counselors are graduate-level mental health service providers trained to work with individuals, families, and groups in treating mental, behavioral, and emotional problems and disorders using the behavioral approach. Licensed professional counseling has standards. The CACREP accreditation are safeguards for the profession, setting minimal competencies for colleges and universities. The National Board of Certified Counselors is a national test that counselors must take. Counselors must have 100 hours of continuing education each year, and there are ethical standards. Professional counselors have ethical standards. The American Counseling Association has delineated some standards. Counselors must deal with a variety of ethical issues and dilemmas. Specific standards guide their practice, including confidentiality and privacy, privileged communication, roles and responsibilities, boundaries, informed consent, professional responsibility, and competence. Professional counselors take a behavioral approach to helping clients. There may be times that another approach would be helpful or appropriate for a client. Therefore, a counselor develops relationships with other helping professions, such as social workers, psychologists, nutritionists, advocates, psychiatrists. Counselors also develop relationships with organizations like the United Way, NAMI, the National Alliance for Mental Health. In Houston, in the Houston area, there's Bose Place and the Harris Center and MHMRA. These are all places that counselors can develop relationships to help their clients. Professional organizations allow counselors to gain important connections with the profession. They gain needed professional development, keep abreast of current issues in counseling, and have opportunities to advocate for their profession and to serve the counseling profession. As a licensed professional counselor with a person-centered approach, my identity is shaped by my belief that each individual has the capacity within for self-discovery and growth. My primary goals are to provide a supportive, non-judgmental environment where clients can explore their thoughts, feelings, and experiences. In addition, adhering to the ethical standards of the counseling profession. For adults struggling with anxiety, depression, grief, or the myriad of other mental health issues, I aim to create a safe place where they can feel freely to express their emotions and find ways to cope with the things that bring them suffering in their lives. Drawing from the works of Carl Rogers, I emphasize the importance of empathy, unconditional positive regard, and congruence in the counseling relationship. By actively listening and reflecting and validating my clients' experiences, I hope to foster a sense of self-acceptance and personal agency. In my work with children, I am particularly passionate about the use of play therapy. Counselors, when working with children, should develop connections with the child. They should accept the child as is, establish a feeling of permissiveness in the counseling environment, be attuned to the child's feelings, respect the child's agency, and follow the child's lead. The counselors take the time that is necessary to complete the therapeutic process and to set limits to anchor the child. Through the use of age-appropriate activities, toys, and play, I aim to create a therapeutic environment that is engaging, non-threatening, and conducive to emotional exploration and healing. By integrating these approaches and others as necessary to meet the needs of the client, I aspire to be a licensed professional counselor that is holistic, client-centered, and responsive to the diverse needs of my clients.